Okay, so let's start from the top. Okay, Phil, the entire rehab pathway is going to take anywhere from 10 to 12 weeks. Now, the reason we say this first is because this sets expectations. So, I'm not telling the patient that it's going to be a quick fix. I'm telling them right away it's going to take 10 to 12 weeks. So when I do pitch them the frequency, they're like, oh, well, it's a long-term care plan, so I didn't expect it to be so short anyway. And the best way for us to shorten that time frame is by following rehab instructions closely and by coming in a few more times in standard recovery so we can push your rehab. Now, the reason we say this is because by saying following rehab instructions closely, this is to demonstrate our authority. But then I also say coming in a few more times more than standard recovery so we can push your rehab. This is clinically actually sound. This is a clinical justification for why we pitch a longer care plan. Now, the clinical justification is this. If we look at this statement from a physiological point of view, there are patients who are fit, they're healthy, or maybe they're super fit and healthy, where they will have a 48-hour window where they will recover and adapt to the rehab, where you can actually push them a bit further along. So for some people, they recover so well that within 1 week, they will have the same recovery as somebody who is 2 weeks in because the histories are just different. And so when I say a few more times than standard, we are telling these people, if you are wanting to go quicker, if you recover in time, by coming in earlier, I can progress you quicker, you will adapt quicker, and you might be able to shave some time off the full course of rehab. Okay, so that's the clinical justification. Okay, and then at the end I say, how does that sound to you? And the reason we use this is because we want to ask a permissive question. And so what that does is it increases the amount of buy-in, but also perception of control.